most famous physical therapist on the internet.
Hi folks, I'm Bob Schultz, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about 7 big lies about treating knee arthritis you should know.
There's a little controversy. We'll talk about it as we go through it.
Sure. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels because we are always giving something away. Always. And right now, we're giving away the Ergonomics Innovation Donut Cushion. And this is great for sit bone pain or tailbone pain or just some people just like it.
If you broke your tailbone or fractured, a lot of pain there, and you need that hollow spot there to relieve the pressure, it's there.
I guess it would work for hemorrhoids too, wouldn't it, Brad?
Absolutely, Bob.
So this was a study that was first done in 2009. I should say a study. They looked at hundreds of studies, Brad. This is the Royal Australian College of General Practitioners. So they got this huge group. They look at hundreds, maybe thousands of studies.
Sure.
Regarding knee arthritis and actually hip arthritis too.
Okay.
They first did it in 2009. They redid it in 2018. So it's guidelines for non-surgical management of hip and knee arthritis. Today I'm just going to talk about knee arthritis. So that's what the title is. What they do is they do various degrees of recommendations. Like they'll say strongly against or conditionally against, which is not as not as severe. Then they also go strongly for or conditionally for.
So there's that gray zone.
Yeah, right.
So to speak.
So let's start off with the first one, Brad, because I get a lot of people that ask me this. Should I use glucosamine and chondroitin?
And what the studies say?
They said they were against the use of it. There was they didn't see any benefit to it and concerning the cost. And
so it was strongly against?
I'm sorry, I don't remember. I just put recommended against. I didn't do the conditional ones on those. I
don't think with those there's any particular bad side effects.
No, it was
that product.
But again, they're like, why do things that aren't going to help, basically.
Right, right. They're scientists.
The second one is going to even maybe surprise you a little bit. Recommended against use of an ice pack. To me, it always makes sense because, a lot of times arthritis is inflammation.
Mm-hmm.
So you think you want to put ice on it, but the thing is, it generally, they found out a lot of people with arthritis, they like the heat.
Sure.
It feels a lot better. They recommended against the use of an ice pack.
I have to admit, I had a patient that severe knee arthritis, couldn't even walk, and she did not like heat, and she was very alert, and she said she kept ice packs in her room, and we put it on. So there
may be exceptions to the rule there.
Right.
So this is the biggest one, I think, of the 7, Brad.
Okay.
They recommended against arthroscopic meniscectomies, cartilage repair, all these surgeries, unless the knee was actually locking.
So a mechanical clarity is very clear.
And you say, well, how could they recommend? I'm having a lot of pain. They found out that if you had the surgery like 5-6 months later, you're back to right where you were before.
Okay.
So
but we're not talking about knee replacements.
Not knee replacements. We're talking about just arthroscopic surgeries, or where they go in and replace or trim off the meniscus and stuff like that. This is a big one. Because a lot of people, I think they still do recommend. You'll find doctors that do recommend this.
Right. Go in there, clean it up a little bit, and see how things.
But I have to be honest. A lot of the people that I know that did have it done, they were back to square one fairly quickly. It's a little discouraging.
They wouldn't go to the therapist if it worked.
No, and that's the thing. You really just want to recommend conservative things to try first before you try things like that. So they recommended, I kind of threw 3 of them together here on number 4. They recommended against acupuncture, Kinesiotape, and topical Capsaicin. So that I just heard of it. I never used it. Topical Capsaicin.
Yeah,
it's just a rub, I believe you put on.
I got some Kinesiotape.
Yeah, we got the Kinesiotape. You see it very popular. You see the Olympic athletes wearing them. Everything's, oh boy, that's really cool. But the studies have just not held up on these. Sorry.
And we have people comment that they love their Kinesiotape. Yeah. It helps. I personally, if it works and you really think it helps, I don't think there's any negative side effects.
No, it's a placebo effect sometimes, and if it's a placebo, it works. Placebo.
It's better than taking pain pills.
That's right.
If it does that.
All right, now that was the things they had a whole bunch of things they recommended against. Those are the ones I kind of singled out.
Sure.
But here I'm going to give you some things they recommended.
Okay.
And unfortunately, with the knee, you are limited. There's not a great amount of things. They strongly recommended land-based exercises. What is that? That means versus water-based exercises. So They thought it was better that you actually exercised out of the water than in the water.
So walking,
muscle strengthening, and Tai Chi was really highly recommended, or was recommended.
Okay, so that's a slow form of exercise.
Do you know how to do it at all?
No, it's a martial art. I've trained in a different style, quite a bit, drastically different, but from what I understand, you go through moves very slowly.
Very slow,
which makes a lot of sense. It's going to help with your balance, your range of motion,
and your strength.
Yep.
Give that a shot, but definitely the walking. They also, number 6, they recommended, and this makes sense, is just shock absorbing footwear, putting something in your shoe, and no high heels, because that's going to put weird stresses on you.
Yeah.
So you're going to stop wearing high heels, Brad?
No, not me. But I'm sticking with them.
You're sticking with your fashion, huh? All right, number 7, no surprise here either. Recommended weight loss. And while you're trying to lose weight, sometimes this is a motivator. You could use a cane or a crutch or a walker. My wife was having some knee pain, and it was to the point where first she said, "There's no way I'm going to use a cane or a crutch." But she ended up using a crutch because it was so bad that she was limping so bad she couldn't even walk.
So with the crutch, it was much better.
Yeah, this was actually the one she used. I actually got some padding for her.
Right.
Your under the arms gets really sore, and your hands get really sore from using all the time.
That was very, very nice of you, Bob,
Yeah,
to
it
do
was.
that for your wife.
But she, after a while, it calmed down, and now she's back to walking, and it's not an issue.
Yeah.
I did some manual things on it too. But
we don't have to get into that.
We don't have to get into that.
Family show.
But what are you talking about?
Just saying. Let's go on. Let's carry on.
So that was it, Brad. That's number 7. You got to try to take some of the weight off of it, so you can, again, using a cane or a crutch or a walker.
Well, I did want to say one thing. I wanted to back up a few steps. I'm really surprised that the water exercise would be good for it, because it's, that was, I think most people
I'm surprised
had
they talked about it. I don't remember if they actually recommended against it, or if it was a recommendation, but it was a lesser recommendation. Right. It's just, I think there's something about actually taking the full weight through the leg, and the effect that it has on the knee, and creating some of the oil there, basically.
You're lost there, Bob.
Yeah, I lost there. I lost my thought.
That's okay.
I'll get chopped off anyway.
I'm saying if you got a swimming pool and it feels good to get in there and exercise, because I recommend that to my patients, but the problem is very few people have that option.
Right, and I think that's part. They take into account everything. They take into account the convenience of it, the cost of it, and so they'll recommend things that are a lot easier to do, that you're more likely to do.
That makes sense.
So
then I concur.
All right. Well, we welcome all your comments, and sorry for the little pause there I had. Thanks for watching.
Enjoy.